The Global Prevention Coalition meeting was held in Nairobi on Monday as members deliberated ways of addressing the alarming rates of new HIV infections being recorded. The coalition, which marked 6 months since it was formed, was here to celebrate achievements made in dealing with this global HIV threat. Health Cabinet Secretary CS Kariuki says in order to achieve the targets of the 2016 Political Declaration on Ending AIDS, including a 75% reduction in HIV infections towards fewer than 500,000 infections by 2020, there is need for greater cooperation.
We are focused on delivering investment in preventive and promotive health at primary levels to attain the goals we have set, and HIV has lessons for us in Kenya to learn.
Kariuki further noted that stigma and discrimination remains the biggest challenge in addressing the HIV scourge.
We have since made great progress at instituting national systems for HIV prevention, and we have experienced a declining HIV incidence in many of our countries. With just a few months to 2020, we have made limited progress in some areas, including adolescents and young people. This is driven by behavioral and structural factors, violence, stigma, and discrimination that operate beyond the health sector.
While noting remarkable progress in the fight against HIV in Kenya, the CS said there is need to introduce comprehensive sex education in schools so as to deal a bigger blow to HIV, especially among teenagers, which has hit alarming levels.
Resultantly, a cycle of teenage pregnancies, HIV infections, increased rate of mother-to-child transmission, school attrition, and high fertility rates have been experienced.
The Global Prevention Coalition co-chair Sheila Tlo disclosed that the coalition plans to sensitize the communities at the grassroots about safe sex, saying lack of knowledge has contributed immensely to the new infections.
We need to strengthen communities because health care is made in communities. When it comes to the hospital, it's failed health. So we need to therefore work with our young people, both men, young men and women, to ensure that communities are reached with information.
Global Prevention Coalition is a coalition of 25 United Nations member states with the highest HIV burden and was established to support global efforts to accelerate HIV prevention by strengthening and sustaining political commitment for primary prevention and setting a common agenda among key policymakers, funders, and program implementers.
The main agenda is to curb the issue of AIDS, the prevention of AIDS. Remember, they're telling us they're trying to reduce by 75% HIV infections by the year 2020, which translates to 500,000. And of course, curbing the epidemic or AIDS epidemic by the year 2030.
Reporting for Channel 1 News, I'm Timothy Kipnusu.